Okay, so I'm now going to put together part 2 of my video of Event 201. It was all supposed to be one video, but the first one already got to half an hour, so it's better to have multiple short videos. So if you haven't already seen the first one, I recommend that you go back and watch that one, so it makes a lot more sense. If you still don't, Event 201 is basically... It was a thought tank held by the John Hopkins University in October of 2019, 2 months prior to the coronavirus. And in this thought tank, they brainstormed what would happen if a coronavirus outbreak were to happen, and how do we prepare? And it speaks about things such as isolation, shutting down the world economy, shutting down travel, people like panic buying, and it describes exactly what happened to the tea. Now, is this a coincidence? I don't think so. And it doesn't just describe a virus, it describes this particular kind of virus, because think about it, we've had Ebola, we've had MERS, we've had all these other things before, but they have not required a global shutdown. They have not required the social distancing, the level of social distancing that we're seeing, or the panic buying. And everything that we're seeing now and the things that make this particular virus unique is what was spoken about 2 months prior, when this university got together and they planned, well, what do we do if a possible virus outbreak happens in the future? Well, many people don't believe this is coincidence. They believe that wasn't actually a thought tank for a potential virus outbreak in the future. They think that they were planning the outbreak and they labeled it as a thought tank as a way of just saying, oh, well, it's an imaginary play scenario of something that could happen. So it's a way of downplaying it. So I'm going to show you a couple more videos from Event 201, and we're going to compare it with what has actually been happening with current events. Okay, continuing off from the trade and travel discussion video, starting from 1 minute 50 seconds in.
People are avoiding public spaces out of fear of infection and in compliance with public health recommendations. This has had a dramatic effect on the retail and service sectors. Businesses of all kinds are struggling to...
Okay, does that sound familiar? So notice also the empty shelves there. They also showed that in the video.
Including many of the makeshift triage and temporary care facilities. People are avoiding public spaces out of fear of infection and in compliance.
Look at those empty shelves. This video was uploaded, again, on the 4th of November 2019. Before there were any... Over here, hold on. Before there were any empty shelves or people were panic buying. They knew about the virus, they knew about the world shutdown, the crashing of the economy, the empty shelves. Hey, there's self-isolation. Going back to the future, that's exactly what happened. Here we have an article from The Sun, shocking pic of the paramedic staring at the empty Sainsbury's shelves after the coronavirus panic buying. Empty. 2 months before any of it. So they didn't just know there was going to be a virus. It's all the little details and like fine-tuning that they knew about. So I'm returning to the video that was 11 minutes 46 seconds, and I'm going to watch 8 minutes 20 seconds in. Alright, watch this.
It's the overwhelming amounts of dis and misinformation circulating over the internet. In some cases, limited internet shutdowns are being implemented to quell panic.
How much control of information should there be? And by whom? And how can false information be effectively challenged? And what if that false information is coming from companies or from governments?
I think it's very important that we make sure that there is concise communication with all healthcare facilities where these patients are being treated.
So, Here in this part of the video, they talk about false information, and they also go on to talk about incorrect facts being spread around social media. And this is something we see a lot. We've recently seen those Facebook fact checkers that if you type something that doesn't fit the mainstream news narrative, it will basically block the post and tell you why you were wrong. And it seems to block anything related to 5G or almost anything that doubts the coronavirus. I made a post on how cell phone radiation is dangerous, and they basically fact-checked it saying, oh no, it's not, because cell phone radiation is non-ionizing and non-ionizing radiation is safe, which is not true. I mean, you can check if you have an iPhone, for example, and you go into the settings of that iPhone, they have to, by law, give a warning not to hold it too close to your face, and that studies have shown that this can cause cancer. So we have these Facebook fact checkers, and we have so many people who are being taken off social media, especially YouTube and Facebook. David Icke recently had his whole YouTube channel banned. Now, it doesn't matter what you think of the guy, whether you think he's a nutter or whether you agree with his opinions. Everyone does have the right to free speech and to say their opinion. Now, if you think that certain viewpoints are dangerous and should be filtered out, then that's a very slippery slope, because who gets to decide what information is allowed and what information is inappropriate or false news, for example? What happens if someone tries to spread information on some government scandal? Would that also be considered fake news? But it's been interesting the way they've been doing it. You know the whole expression, if you want to cook a frog. Well, it's not an expression, it's actually real. Like, seriously, if you want to cook a frog, you don't put the thing in hot water because it's going to jump out. Usually what they do is they put in cold water and you slowly increase the temperature, slowly cook it. And that way, because the temperature is only a little bit warmer than before, a little bit warmer, they don't actually recognize that they're actually being cooked. It works the same with humans, not for boiling water, but for propaganda and manipulating people. So if they just began banning everyone on YouTube that had a different opinion, people would be up in arms. But they began with the most controversial figures first. They started with Alex Jones, and so many people hated that guy. When they announced that they were banning him from YouTube, so many people were like, good riddance, like, it's about time. But the problem with that logic is, once they're able to ban someone like Alex Jones, and we have already accepted it, they will go for someone who is also controversial, but a little bit less extreme, like David Icke, then someone else. And slowly, over a matter of years, they get you accustomed to that. Eventually they have the whole platform censored. Actually, it's interesting that the coronavirus happened in 2019, but I believe, it happened towards the end of the year in 2019, but I think Alex Jones, he was banned in early 2019, which shows already back then that they were starting to censor people, prepare YouTube. There was a 1-hour interview with David Icke and Brian Rose on London Real. And because they mentioned when it was being aired, it was the second biggest live stream in history. No, it was the second biggest live stream during that day. The only thing that got more views was Donald Trump's speech, and it was basically taken off. Also, Brian Rose also aired that same interview on a London cable channel, and that cable channel had to apologize for airing it. Okay, so here's some of the articles we spoke about. This one, for example, says AI and fact-checking how Facebook deals with misinformation amid COVID-19. And you'll see in this event 201, they talk about how when this virus comes out, there's going to be quote-unquote misinformation, and they speak about how they're going to deal with it and how can they get the correct narrative. Now, also, when you listen to this event 201, you have to read between the lines. When they mean misinformation, what they're actually trying to do is stop people from recognizing what's actually happening. They're trying to push their propaganda that, oh, there's this virus is so deadly, so many people dying. And look, if you look at the actual stats, like you look at the mortality rate for the UK or the EU, you find that these numbers are the same. But yeah, anyways, so Facebook has began fact-checking. Here's one. Social media is failing miserably at battling the spread of coronavirus misinformation, as from The Independent. And you know what? What they're actually saying here is usually the opposite. Social media and places like WhatsApp is probably one of the only places where people get accurate news, because it's not all biased, controlled by one source. People get to post various opinions and points of views, and you can explore different ideas, and it's absolutely amazing what technology has done. And what these large organizations want to do is they want to take that and try to dictate the narrative, make it one thing that fits the agenda in which they're trying to push. Okay, so come check this. It's basically different news stations following the exact same script, word for word. So it doesn't matter where you go to watch the news, it's all controlled by the same source.
Of biased and false news has become all too common on social media. More alarming, some media outlets simply aren't true without checking facts first. Unfortunately, some members of the use their platforms to push their own personal bias and agenda to control exactly what people think. And this is
So notice they all said exactly the same thing. Different news stations, and also the irony in this, because if you listen to what they were all saying, they were talking about how false information is being spread on YouTube and Facebook, and people are just sharing posts without checking facts first. And maybe there's a little bit of truth in that, but there's also a lot of accurate information that we would never find in mainstream media that's being posted on Facebook, such as the overdiagnoses of the COVID-19 deaths or the mercury in vaccines. Now, you know, so what they have here is they're busy like saying that all this false information and biases are being spread on social media. And here they are saying the exact same script, word for word, being biased, not being like a proper news organization, being independent and looking at things for themselves. They're just all reading the same script.
A child's happiness is priceless, especially on a birthday.
A child's happiness is priceless, especially on a birthday.
A child's happiness is priceless, especially on a birthday.
a child's happiness is priceless, especially on a birthday.
Well, a child's happiness is priceless, right? Especially on a birthday.
A child's happiness is priceless, especially on a birthday. A child's happiness is priceless, especially on a birthday.
A child's happiness
is priceless, especially on their birthday.
A child's happiness is priceless, especially on a birthday.
A child's happiness is priceless, especially when it comes to their birthday.
Absolutely.
A child's happiness is priceless, especially on a birthday.
A child's happiness is priceless, especially on a birthday.
Well, a child's happiness is priceless, especially on a birthday.
A child's smile is priceless, especially on a birthday.
A child's happiness is priceless, especially on a birthday.
You know, a child's happiness is priceless, especially on a birthday.
A child's happiness is priceless, especially on a birthday.
A child's happiness is priceless, especially on a birthday.
A child's happiness is priceless, especially on a birthday.
A child's happiness is priceless, especially on a birthday.
A child's happiness is priceless, especially on a birthday. You like that?
In consumer news, economic factors may take some spring out of the Easter Bunny step this year.
Economic factors may take some spring out of the Easter Bunny step this year.
Economic factors may take some spring out of the Easter Bunny step this year.
Economic factors may take some spring out of the Easter Bunny step this year.
Economic factors may take some spring out of the Easter Bunny step this year.
Economic factors may take some spring out of the Easter Bunny step this year.
Economic factors may take some spring out of the Easter Bunny step this year.
Economic factors may take some spring out of the Easter Bunny step this year.
Economic factors may take some spring out of the Easter Bunny step this year.
Economic factors may take some spring out of the Easter Bunny step this year.
Economic factors may take some spring out of the Easter Bunny step this year.
Economic factors may take some spring out of the Easter Bunny step this year.
Economic factors may take some spring out of the Easter Bunny step this year.
Economic factors may take some spring out of the Easter Bunny step this year.
Economic factors may take some spring out of the Easter Bunny step this year.
Economic factors.
Mike Myers says, yeah, baby.
Mike Myers says, yeah, baby.
Mike Myers says, yeah, baby.
Mike Myers says, yeah, baby. Did I say that right?
Yeah, say it right.
Yeah, baby.
Talk show host Conan O'Brien may be about to push the envelope on late-night television.
Conan O'Brien may be able to push the envelope on late-night television.
Conan O'Brien may be about to push the envelope on late-night television.
Conan O'Brien may be about to push the envelope on late-night television.
Conan O'Brien may be preparing to push the late-night envelope.
And welcome back to the show. I scream, you scream. You know the rest.
I scream, you scream, you know the rest.
I scream, you scream, you know the rest.
I scream, you scream, you know the rest. Well, I scream, you
know the rest.
And here's one of the articles referring to what I spoke about, where David Icke was banned. Coronavirus fake news. YouTube deletes conspiracy theorist David Icke's channel following false COVID-19 claims. And again, just slowly boiling the water, starting with the most controversial people first, or the people who are seen as the most out there. Okay, and censorship got worse after the coronavirus, but it's been happening for a long time. As I said, they start with the most controversial. Here we have Alex Jones. So this was basically a while back. Alright, so this actually happened my memory was wrong. It happened on the 6th of August 2018. Facebook, Apple, YouTube and Spotify ban InfoWars Alex Jones. So it's been a slow process. They've been slowly, doing it over time, getting us accustomed to it. One last one before I go into the next clip from the video. This is from BBC News. So Ofcom, COVID-19, 5G theories are most common misinformation. Unfounded theories linking COVID-19 to 5G technology are most common example of online misinformation in the UK, and Ofcom survey suggests. So basically, everyone, there's been a lot of theories going out that when this 5G was going to be rolled out, you'll see people sick all over the world and they would have to come up with an excuse like a major disease. So that's what a lot of people, theories and things are saying that are going around on the internet. And this article is basically accusing that of being misinformation. I'm just kind of pointing out how how this John Hopkins University's event basically prepared for everything that's happening now in terms of the information that's going back and forth. And I'm just doing a summary here. They actually go into a lot of detail into all sorts of things. Going back to the shorter video, the 11 minutes one, and I'm going to play from 8 minutes 54 seconds in.
Moment where the social media platforms have to step forward and recognize the moment to assert that they're a technology platform and not a broadcaster is over. They in fact have to be a participant in broadcasting accurate information and partnering with the scientific and health communities to counterweight, if not flood the zone, of accurate information, because to try to put the genie back in the bottle of the misinformation and disinformation is nigh impossible.
One thing we haven't spoken about, and I'm wondering whether it's time to talk about this, is a step up from the part of the governments on enforcement actions against fake news.
I personally
Okay, so I am watching Event 201 Pandemic Exercise Segment 2 Trade and Travel Discussions, and I am viewing from 1 minute 38 seconds in.
The frightening public health toll of caps continues to mount. Patients are overwhelming healthcare facilities around the world, including many of the makeshift triage and temporary care facilities.
Okay, so overwhelming healthcare facilities all over the world, and of course this is still on the 4th of November 2019, 2 months before the COVID-19 outbreak. So they already knew that healthcare facilities all over the world was going to be overwhelmed. So here's one of many articles that we see speaking about the healthcare system being overwhelmed. This is from Metro. It says NHS nurses, they are so overwhelmed with deaths they cannot cope. Just to remind you that there's always two sides to every story. We are also receiving a lot of articles like this one. A lot of people speaking out. 243 hospitals furloughed workers in response to COVID-19. So on the one hand they're saying, oh look how full everything is, and then on the other they're having to let off workers because there's apparently not enough work. So on this point I recommend having an open mind and looking deeper. Well, is the healthcare service actually overworked? Okay, so now we're going to look into the event that has not happened yet, the shutting down of the internet in certain parts of the world. And well, it's partially happened. It also talks about further censorship and filtering what people can and cannot see. So I'm watching Event 201 Pandemic Exercise, Segment 4, Communications, Discussion and Epilogue Video. Now this one, a large part of it deals with so they're busy discussing false news and what can they do about false news, about the basically this coronavirus in the simulated scenario. And false news should be put into inverted commas. When they say false news, what is actually meant is the actual truth that they're trying to filter out. Yeah, so one of the things they speak about in the video is putting a lockdown on the internet, switching the internet off. But yeah, and just putting more restrictions and things like that. So I'm going to play from 1 minute 19 seconds in. Let's do full screen.
Alarming news emerging from social media companies today about the CAPS pandemic. Twitter and Facebook are reporting they've identified and deleted a disturbing number of accounts dedicated to spreading disinformation about the outbreak. For more on this, we go to our correspondent, Catalina Parks.
Chen, these accounts were created by several state-sponsored groups intending to sow political discord, and some individuals are seemingly seeking to gain financial advantages. Violence against healthcare workers and minority populations has been increasing. A recent riot highlights the real danger in these posts. Countries are reacting in different ways as to how best to manage the overwhelming amounts of dis and misinformation circulating over the internet. In some cases, limited internet shutdowns are being implemented to quell panic.
Thank you, Catalina. For more on this, we are joined by experts on crisis communication.
I also recommend you look at the London Real Army, and that was a whole movement that came out of Brian Rose doing a 1-hour video with David Icke, and his whole video was basically banned. The whole of David Icke's content was taken off YouTube. Yeah, so just that whole thing that happened. So there's been a lot of censorship, and what a lot of people are saying is you got to be careful because the vaccine that they're going to introduce in response to this coronavirus is actually going to make you sicker rather than better in the long term. In the long term, it's going to give you something far worse. Now, if you watch this video, they go on to say, like, they actually said that people were fighting, also I don't think this has happened yet, but patients were fighting nurses, trying to get them away because they believed that the nurses were harming them. So I think what they're going to do is they're going to create some false news event where they're going to say that false information is causing people not to trust the healthcare service and not getting the medication they need. And they're going to use this false narrative as an excuse to basically, you know, the whole problem, reaction, solution. They're going to use that to shut down certain parts of the internet. Anyways, you can go over these videos more in your own time. You might want to look into this article though, if they do decide to shut down the internet. Here it says the US government has an internet kill switch and it's none of your business. The Supreme Court has refused to hear a petition concerning the Department of Homeland Security, secretive internet and cell phone kill switch.
Global health experts have highlighted that dis and misinformation are wreaking havoc on the CAP's response. Health workers are under attack in a number of locations due to rumors that they are purposely spreading the disease. And response efforts in many places have had to be suspended because of concerns around violence. Pharmaceutical companies are being accused of introducing the CAPS virus so they can make money on drugs and vaccines. And have seen
vaccines, that's a big note. That's one to take a note of. Remember to look at J.F. Kennedy Jr., the small claims court, and chemicals like mercury that are put into vaccines. Anyways, continuing on.
Faith in their products plummet. Unrest due to false rumors and divisive messaging is rising and is exacerbating spread of the disease as levels of trust fall and people stop cooperating with response efforts. This is a massive problem, one that threatens governments and trusted institutions. Polls have shown that mis- and disinformation are ubiquitous. At least 90% of the public has been exposed to these messages. At the same time, misinformation.
Okay, and how they're going to deal with misinformation? They are going to censor everything so that you are only receive one narrative, and that's the narrative that the World Health Organization wants you to see. YouTube has already announced that they do not report on, they ban any news that goes against the World Health Organization guidelines, which is owned by who? It's owned by Bill Gates, who wants to vaccinate the world. The same Bill Gates that was laughing earlier in the video. So, yeah, it's just, and they say, well, they're losing trust in medical treatments like vaccines and stuff. Well, it's for pretty good reason. You know what, I'll give you, I got a vaccine and I got temporal lobe epilepsy for it. I know someone who had 5 brain tumors and lupus. Apparently, according to the doctors, it was an incurable disease, and unless this person did chemotherapy, she was going to die. She did not do chemotherapy. She did other alternative medicines, which worked off herbs, and actually got better. Following brain scan, found that the tumors were gone. And then it really opened up our minds, like, wow, like, because I used to think before, I mean, if there was a cure, it would be all over the news, people would know about it. But also then again, if some thought tank announced like something like this, so similar to the coronavirus 2 months before, simulated the whole thing, you would think this would be all over the news, but it's not. Now, this coronavirus that's happening now is not going to be the last one. As they said, there's going to be multiple waves, each wave getting worse than the last. And with every time they do this, they're getting you used to the new system of government control, and they're implementing new laws that limit our rights and freedom. Such as this one, this from the BBC, coronavirus people tracking wristband, and they're saying, oh, we need to put this wristband around you to see if you're social distancing. They've done other things like allow phone companies to track us. They're using this as an excuse to implement laws they usually would not under normal circumstances, but they're saying, oh well, it's a pandemic, we might as well we have to implement these sorts of things. So, Bulgaria is the latest country to test the wristband that can track people during the coronavirus pandemic. What fun. Anyway, scrolling down, let's check some of the countries that have been involved with this. So we have Belgium, where residents are testing a social distancing wristband that vibrates if it comes within 3 meters of another band. I think this is the slow rollout of communism. Here we have another one. Alright, Manchester, where 1 in 10 residents will be given a band to track temperature, breathing and heart rate that transmitted to a lab in Switzerland for further investigation later this year. A further 18,000 residents will be given a band. India, which has announced plans to manufacture thousands of location and temperature monitoring bands for people in quarantine. Hong Kong, where police can be alerted if people are not wearing the electronic device. And there's been loads of articles like this. They've been armed. Like, there have been police armed in, like, military vans arresting people for not isolating. They have said in some countries, if your neighbor isn't self-isolating, then you can call the cops on them. This is an excuse to roll out a communist system, and I could get deeper into this. Yes, rather you could talk on hours about what is actually happening here. Here's one. Google, Facebook could help US track the spread of coronavirus with phone location data. Also, all over the world, we're seeing apps to see if you do social distance. Download virus app to save lives and end lockdown. Hancock urges as trials begin. Oh, good Lord Jesus. Alright, and here we have the ending of, here I'm going to play basically how the whole thing ended. And do you remember how on the news they're announcing that this COVID-19 could be a seasonal thing and we could have multiple outbreaks, there could be a second wave and a third wave, and we need to keep social distancing until a vaccine is potentially introduced. Yeah, so again, problem, reaction, solution, creating a problem, creating a lot of tension in you, and getting people just emotionally wound up to be like, oh, we need a vaccine for this sort of thing. Anyways, here they are in this video released in 2019 talking about, of course, multiple waves and how are we going to prepare for one of these second, third waves. And she basically says, well, we were so badly prepared that... watch.
We have to ask, did this need to be so bad? Are there things we could have done in the 5 to 10 years leading up to the pandemic that would have lessened the catastrophic consequences? We believe the answer is yes. So, are we as a global community now finally ready to do the hard work needed to prepare for the next pandemic?
Alright, so if you enjoyed that video, please give it a thumbs up and subscribe and tick the notification button to get notifications whenever I produce a new video. Now if you're watching on the other platform, LBY, just follow me.